Ladies and gentlemen, hello and welcome. Thank you for joining this morning's presentation. The information you will hear is especially designed for PEB participants about to turn 65 and or about to retire and enroll in an individual Medicare plan. My name is Debbie Nelson. I am from VIA Benefits and I'm delighted to be your host for the next hour or so. We know this is an exciting time in your life as you anticipate retirement. And we want you to know that we are here to help you with your health care so that you can have the peace of mind that you deserve so that as you go into retirement, you'll know that you have good coverage and you can enjoy your time. I want to take just a moment for a little housekeeping, if that's okay. We will make sure that everyone has their audio in place so they can hear. If you're hearing my voice, fantastic. That means we're off to a great start. If you need to reset it during the presentation, you would do that by undocking the control panel. Click on the red box with the white arrow. Go over to audio. There's a little down arrow that opens up this option. If you toggle between computer audio, no audio, and back to computer audio, that does reset the sound. Also, as a plan B, you can select the phone call option. You'll dial the phone number that pops up and the dial-in code, and then you'll be able to listen to the presentation on your cell phone. You still would need to watch the slides on your device, however. There would be no slides on your phone. And at the end of the presentation, we will take some time to do questions and answers. So if you go to this question box just below the audio drop-down arrow, you'll click on that and that'll expand out where you can type in your questions. And anything of a very personal nature, I would recommend you jot that down and hold on to it to talk to a benefit advisor. But something just for a general overview that would be beneficial to the full group to hear, go ahead and type those in and we'll share some of those questions at the end of the presentation. It's always fun to hear the questions that other people have, and I think we all benefit and learn from that. So we're ready to get started now, and this is what we're going to cover here today. So I'll talk a little bit about who VIA Benefits is. Now maybe you've heard our name before, but just a little information about us so that you know the resources available to you and how to take advantage of those resources. We'll talk about Medicare. VIA Benefits does represent all Medicare plan types, and so I know it can be a little bewildering, so I want to give you a really nice framework so that you feel confident that you know what your options are and make it real simple for you. We'll talk about how to work with VIA Benefits, and then we'll also highlight a little bit, just as coming attractions, that Health Reimbursement Arrangement, HRA. That's your continued funding from PEB as you move into this program and go to your individual Medicare plan. We have an action list for you, just a couple steps that you take between coming on the group plan and then moving into your individual Medicare plan. And then we'll have our question and answer period at the end. We know that healthcare is one of the biggest concerns that you have at this time of life as you're planning for retirement, and so we want to give you that peace of mind that you are looking for. Now, VIA Benefits is not an insurance company. There is no such thing as a VIA Benefits plan. What we are is the first and largest private Medicare company. 16 years ago, the founder of our company was trying to help his parents enroll in a Medicare plan. And everyone he talked to would recommend a different plan, and he was getting more and more confused the more he talked to people. So he soon realized that there was really not a company out there that had the retiree at their as the most important thing in their mind, as their advocate. And so he thought to himself, you know what, I think I'll start a company that does that very thing. So he did just that, and we, at that time, the name of the company was Extend Health, and that actually still is our legal name. And I know some of you enrolled back when we were Extend Health and have been with us for a long time now, probably 10 years or so. We have over 2.1 million retirees that we help each day, sun up to sundown, in our service centers, and over 120 different insurance companies that we represent to you. So we can really help you look at a great plan in your area and help you make an informed and confident decision. When you work with VIA Benefits, there's two different ways that you can do that. We're very excited about the new enhancements we've made to our online features. So I'm going to talk a little bit about that today so that you can go online and learn all kinds of things. There's lots of resources there for you. And actually, currently, you can enroll start to finish in 93% of our plans. So we're very excited about that. A lot of people have been asking for that. This drop it in the cart and enroll yourself has been a big request. And so we're very pleased to be able to offer that to you now. And then, of course, as always, we have our wonderful benefit advisors, licensed, certified, and appointed, and located in Salt Lake City, Phoenix, and Dallas. Those are our 3 service centers. Most of our benefit advisors currently are working from home, though, but those are the general areas that they are located in. We are open 13 hours a day, so in Pacific time, that translates to 5 a.m. in the morning until 6 p.m. So basically, all day, you can give us a call, and we can help you with any concerns you might have with your Medicare. I like to recommend, though, that you take advantage of all the resources available to you. So maybe a hybrid of this would be great. Now, I'd like to introduce Nicole. She is from PEB, Nicole Pluta, and she's going to talk to us a little bit about aging into Medicare. Thanks for being here, Nicole.
Thank you, Debbie. So hi, everyone. I am Nicole from the Public Employees Benefits Program, and we are going to be going over a lot of information today, so feel free to take notes, but also know that this presentation will be recorded and posted on PEB's website as well as VIA Benefits website. So if I go too quickly through a couple slides, or you just want to look back at this information, you can definitely do so, so don't fret. So let's go ahead and jump straight in. Preparing into Medicare. So approximately 2 months before your 65th birthday, PEB is going to mail you a happy birthday letter, a Medicare guide, and then a retiree and benefit enrollment change form. The great thing about all these forms is that you can now access them online. So if you never received the forms, or you're someone who's just tech savvy and prefer to save a couple trees and just access them online, you can do so on PEB's website underneath the plans, getting to know your plan, and retiring before or after age 65. I am going to be referring to this retiree benefit enrollment and change form quite a bit in today's presentation. I may also use the acronym RBECF just so that you are aware. Next slide, please. Okay, so let's go ahead and figure out if you will be eligible for premium-free Medicare Part A. If you or your spouse or former spouse have at least 10 years or 40 credits of work in which you paid Social Security taxes, or you are eligible for railroad retirement benefits, or you are under the age of 65 and approved for Social Security disability benefits, you will qualify for premium-free Medicare Part A. Now, why is that important? If you do qualify for Part A, you are also going to purchase Part B, and you will be transitioning over to VIA Benefits. Now, if you do not qualify for Medicare Part A, please do not purchase it. your steps are going to be looking a little bit different. Just for those of you who aren't quite familiar with Medicare yet, Part A covers about 80% of your hospital care, while Part B covers about 80% of your medical care. Social Security's phone number is listed here on the screen. Once you call them and you start sending in your paperwork, they will tell you if you will qualify or not. So you don't have to worry if you're not sure. If you don't qualify, they will be sending you a lack of credits letter that you're going to hold on to. Every single person, though, is going to be purchasing Medicare Part B. Next slide, please. Okay, so you're going to fit underneath one of these categories, and we'll talk about PEBs and Medicare requirements because they are slightly different. If you have TRICARE, PEB will be needing your Medicare A and B card, as well as the front and back of your military ID card. If you are an active employee, you are not required to enroll in Medicare until 60 to 90 days prior to retirement. I'm going to repeat myself one more time with that because we get a ton of questions. So if you're an active employee, even if you're over the age of 65, you will not be fined if you wait to sign up for Medicare. You do not need to sign up for Medicare until 60 to 90 days prior to retiring. If you have a spouse or domestic partner, PEB's Medicare requirements will apply to the covered spouses and domestic partners. If you are currently retired, approaching your 65th birthday, newly retiring after age 65, or currently retired under 65 and approved for Social Security disability benefits, you will enroll in premium-free Medicare Part A, and you will purchase Medicare Part B. Next slide, please. Okay, so I'm going to go through each of those categories again. I am going to repeat some of the information we just discussed on the other slide. That's just because there's a lot of information, and I want to make sure that everyone is clear on what they need, the steps they need to take, and what paperwork they need to be turning into PEB. So first, let's go over the category of a dependent or a member, that has Medicare A and B, but has covering no dependents. You're just on the plan yourself. You have to enroll at VIA Benefits. PEB will be needing a copy of your Medicare A and B card, and you will fill out your RBECF, that's the Retiree Benefit Enrollment and Change Form, to elect or decline dental. If you're newly retiring, you don't need to enroll in Medicare until about 60 to 90 days. Now, the middle category is where we do have a lot of participants that fit under this category, and you have a couple different choices. So let's just say that you have Medicare A and B, and you are covering a non-Medicare dependent. Could be a child or a spouse. You, as the retiree, can stay on one of the PEB PPO plans, EPO, or HMO, and we like to call that anchored on. So your dependents who are under the age of 65, they're anchoring you on to that PEB plan. Now, if you would like, as a retiree, you can also enroll at VIA Benefits, and you can choose to either terminate your dependents coverage, which I know a lot of you probably aren't interested in doing that, or you can keep your dependents covered on a PEB plan but pay at an unsubsidized rate, which can be rather expensive. So most of the participants that fit under this category, they just stay on a PEB plan until their dependents either age out or turn 65 and can go on to VIA Benefits with them. Now, if you have Medicare A and B and you also have TRICARE for Life, you are not required to enroll at VIA Benefits. PEB will need a copy of your Medicare A and B card as well as the front and back of your military ID. You will need to fill out your RBECF to either elect or decline dental. Next slide. Okay, so what if you're an active employee and you're not yet retiring? I'm sure all of you could answer this for me. What steps do you have to take? You are not required to enroll in Medicare. However, if Medicare is obtained, you will have to submit a copy of your card to PEB The reason for that is because if you are on the consumer-driven health plan and you have a health savings account, then you will, that will automatically turn to a HRA. So is there any benefit in signing up for Medicare when you turn 65 and you're still an active employee? Not necessarily. Uh, if you are not on the consumer-driven health plan, there won't really be any downside for signing up early. However, if you are and you have an HSA, then you will no longer be able to make any contributions if you do sign up before you are retired. So we recommend that people, members, just continue if they're active to not sign up with Medicare until they retire. So what if you're not eligible for free Medicare Part A? I told you a couple slides back that you did not need to purchase it. So you are allowed to stay on a PEB plan, either one of the PPO plans, EPO, or HMO option. You do, however, still have to purchase Medicare Part B, and you will obtain the Social Security eligibility lack of credits letter. That just states that you're not eligible for the premium-free Part A. You'll submit all your documents to PEB, and then your monthly premium will be reduced by $135.50 after PEB receives the receipt of your Medicare Part B card. So for you, if you're someone that's here today and you're listening to our presentation, the portions that talk about that VIA Benefits is going to go over on how to transition over to VIA Benefits, that will not pertain to you because you are going to stay on a PEB plan. However, I do encourage you to continue to stay on today's presentation because we will be going over some HRA that will also affect you. Next slide, please. Okay, so for each option, I said that you can either enroll or decline in PEB Dental. So what will the PEB Dental plan be? What does that include? This is going to be the same as it is now, with your 4 teeth cleanings per year, your 2 bite wing x-rays, your basic and major services covered at a coinsurance rate, your medical plan, as long as you enroll in a medical plan through VIA Benefits, that gives you the option to enroll in a dental plan with PEB. You will need to fill out that RBECF. The PEB dental plan is for the entire plan year. So it's from July 1st to June 30th, which is slightly different than your medical plan, which will be from the calendar year. Your reimbursements will occur automatically, and there's no need to submit a paper claim form. In most cases, your dental premium will be deducted from your PERS pension. And if you don't have a PERS pension, you'll just set up automatic payments online. The chart below will show you the dental rates for a monthly basis. So every month, a retiree only is $49.76. For a retiree and spouse, it is $99.52 for the state retirees. Now, if that doesn't fit your budget or you are interested in a different dental plan, VIA Benefits does offer optional dental plans. So that's something that you could talk to your benefit advisor about and something that you could think about. The PEB dental plan, if you want to ever make any changes to that, it has to be done during PEB's open enrollment, which is from May 1st to May 31st. Next slide, please. Okay, so I know I went over a lot of information and it can be a little overwhelming, so we have broken down the steps, and we like to say that it's as easy as 1, 2, 3, 4, 5. So the very first thing that you do is you will contact Social Security Administration, and you will enroll in Part A if you're eligible, and you'll purchase Part B. The next thing you'll do is you'll send PEB a copy of your Medicare A and B card. And then if you're, you'll also mail or email PEB the retiree benefit enrollment and change form. If you're someone who has TRICARE and you're choosing to stay on a PEB plan, or you are ineligible for Part A, this is where your steps end. Everyone else who's transitioning to VIA Benefits, we're going to go over to step 4, which is you will call and schedule a appointment with the licensed benefit advisor and complete your enrollment with VIA Benefits over the phone. And then the last step is that you'll wait for your funding packet to arrive from VIA Benefits, which can typically take about 8 to 12 weeks. Next slide, please. Okay, so now I'm going to go ahead and pass it back on over to Debbie.
Great, thanks, Nicole. So one thing I wanted to add to that last slide, and you will actually see this, this action list again in the presentation, and I encourage you to, if you have your cell phone handy, to take a shot of this. For number 4, we also do have the capability now for you to actually enroll online as well for 93% of our plans. So that's also another option there for you. And again, if you don't have your phone right now, I am going to show this action list one more time at the end of the presentation. So with that, let's get started on our Medicare overview. Changing gears a little bit here. So VIA Benefits represents all Medicare plan types, and so that sounds like it might be a little bit overwhelming and a little mystical, but actually once you know that there are 2 main paths, it makes everything fall into place and makes it really simple. So you will choose if you want to get a Medicare Advantage plan. Those are your network-based plans and can work very nicely. Some wonderful networks in the state of Nevada. And the other option is your Medigap with the standalone prescription drug plan. Okay, so we're going to talk about these 2 different paths and the differences between the 2. They're both equally wonderful, especially in Nevada. Those, like I said, those Medicare Advantage plans are very robust. And so we will talk about that. And VIA Benefits does represent other plans as well. And we have relationships with over 120 different insurance companies across the U.S. So let's talk now about Original Medicare. So that is your Part A and your Part B. And as you come into the individual market, you'll want to reach out to Social Security and get your Part A and your Part B in place. In order to enroll in an individual plan with VIA Benefits, you will need your Part A and Part B. Now, Part A is your hospital coverage and Part B is your doctor. You do have a premium each month for Part B. That's currently $148.50, and the projected amount for next year is a $10 increase, $158.50. That's subject to their final announcement, but just to know what's coming up. So if you're transitioning into Medicare at this time, everyone does need Part A and Part B to enroll in a plan with VIA Benefits. Then as the core of your benefits is your Original Medicare. Now you, instead of the group plan, you will choose either the Medicare Advantage plan or the Medigap to complete your coverage. And then we do have some non-Medicare benefits as well that you may be interested in and can talk to the benefit advisor on that. Now, we're going to break down the differences between the 2, 4 main points on each of them that really makes it simple to decide which one's going to be the best match for you to fit your budget, your lifestyle, your healthcare needs. Really becomes quite evident quite quickly. So with your Medicare Advantage plan, the first thing to know is these are your network-based plans. Your HMO, Home Maintenance Organization, your PPO, Preferred Provider Organization. These are network-based plans, and you're probably familiar with those acronyms. You can choose the HMO. That is your most restrictive plan. So you have really wonderful coverage within that network. But if you go outside of the network, you only have coverage for doctors outside the network in case of emergency. So if you have a doctor that you're working with, that you've had a relationship for a long time, you'll really want to make sure that doctor participates in that network so that you can continue that relationship. Sometimes people have a doctor within the HMO, but then they have maybe 1 or 2 doctors that are outside of the network as well. And so they tend to lean towards choosing a PPO because that gives them some financial assistance as they go out of the network. You always do have your best coverage within the network, even on the PPO. But as you go out of the network, you can see doctors that that you want to, and you just have to pay extra out of network rates. Now, all Medicare Advantage plans are pay-as-you-go plans, and some of them have really low premiums, even as low as $0. Okay, so a $0 Medicare Advantage plan actually can be a very robust, wonderful plan, and sometimes people are confused by that. They think because there's no charge for the premium that that it might be a lesser plan. But remember, you are paying that Part B premium, and you've paid into the system for those 10 years that you worked and more in most cases. And so those plans actually can be very robust and wonderful plans. They also are bundled plans. So besides your health care, you also will have your prescription drug plan included at the network pharmacy, no extra premium, and many other benefits as well. Sometimes they offer plans for hearing aids, glasses, vision, dental, food delivery even. You can get transportation to and from doctors with some plans. Telehealth is a really popular one right now. And then everybody's favorite, that free gym membership. So these are options that vary from Medicare Advantage plan one to another. So something to really ask the benefit advisor about, and to look online. That information's there as well to get the right plan for you. Each year during the open enrollment period, October 15th to December 7th, you will be able to make changes to your Medicare Advantage plan. So these always have guaranteed issue. You can make changes from one to another, no problem, during the open enrollment period. So those 4 points, once again, they are network-based. So you want to make sure your doctor participates in the network. They have lower monthly premiums, even as low as $0. So you pay as you go. They are bundled plans, so everything's all wrapped into one plan. You have one card that you use for everything. And then they're always guaranteed issue each fall during the open enrollment period. So now I want to talk about 4 points with your Medigap option. So these are not regulated by Medicare directly. They're insurance plans, and so they're regulated by the state, but they do follow Medicare rules. And so these plans, your original Medicare is the core, and then these plans supplement them. And so they have names that are letters of the alphabet. Starts with Plan A, which is the most basic, goes up to Plan N, like November. The most comprehensive plans, I'm going to mention 2, depending on when you age into Medicare and became eligible. Plan F is the most comprehensive, and then Plan G is right next to it with just one difference. Now, each year, as you go into Medicare, you will receive from Medicare this booklet called Medicare and You, and this is my husband's copy that just came for 2022, and it has a lot of information in there, and this chart is on page 76 in the 2022 edition. This chart compares all the Medigaps side by side so that you can see what each of them cover and the benefits that are available to you. So look at Plan A on the left. That is the most basic, covers some good basics at the top, but lots of gaps at the bottom. Contrast that now with the Plan F over on the far right. And you'll see that nice long row of 100%. Covers everything at 100% that Medicare covers, except for foreign travel emergency, which is the only one at 80%. For everyone who was eligible for Medicare, now you could be deferring and not actually been on Medicare at that time, but if you were eligible January 1st, 2020, then you still can get a Plan F. You can choose from all 10 of the Medigaps available to you. Those of you who are coming into Medicare after January 1st, 2020, you are considered newly eligible. And so now there is some regulation in place that says the newly eligibles are only able to purchase a Plan G. But if you'll compare F and G, you'll see that G has everything that F has with only one exception, and that is that Part B deductible. So the G is still a very robust, comprehensive plan. When you go to the doctor for the first time or two, you'll pay that first initial deductible amount. For 2021, that amount is $203. Going into the new year, 2022, it is projected, not officially announced yet, that that new amount is $217. Okay, so one other thing I want you to be aware of, there are something called Part B excess charges, so that when you go to the doctor, some doctors can and do charge an extra 15% that Medicare allows above the Medicare schedule. So Nevada is one state that does allow this. So as you're looking at Medigaps, I want you to be aware of that, because you'll probably want to have a plan that does cover those Part B excess charges. And you see those plans are F and G. Okay, none of the others do. So important information to consider as you're looking at your Medigap. Now the 4 points with the Medigaps. Number one is there's no network with a Medigap. So for those of you who maybe have a second home somewhere, or maybe you spend some time traveling around the country, you have a motor home or something like that, and you want your health care to travel with you, Medigap is a great way to have that benefit. You do pay more upfront, but then you have little to no out-of-pocket expenses as you use your plan. So sometimes a Medigap can actually save you money if you go to the doctor a lot, or if you have some high expenses that sometimes can save you money. And the benefit advisor is really good at looking at this Medicare math with you and for you. The third point with your Medigap is that it is strictly a healthcare plan, and so you do need to couple it with a prescription drug plan. Whereas with the Medicare Advantage plan that was included in that plan, with a Medigap you have a lot more flexibility to get your specific prescriptions on a plan that matches those at the best price. And that flexibility sometimes can save you a lot of money. Now, right now, since we're in the open enrollment period and can make changes to Medicare Advantage plans, sometimes this is the time frame for Medigaps as well. But they're a little bit different than Medicare Advantage plans. In most states, they have something that is called medical underwriting, and that's where they can ask you questions about your health. If you have some pre-existing conditions, they might be able to deny you or charge you more. So as you age into Medicare and retire, those are both special election periods. Back at the office, we refer to those as the golden ticket, because with those special election periods, Medicare grants you the right to choose the plan of your choice. And so very important decision to consider all your options. And if you're thinking about a Medicare or a Medigap, this is a great time to do it as you make your initial transition. So just real quick review, no network, portability, higher premiums, but still not too bad. I have some examples for you in a little bit. You have lots of choice and flexibility with your prescription drug plan, and you do have that golden ticket right now to choose the plan of your choice. So I want to shift gears now. We're going to talk about the Part D prescription drug, and these guidelines will apply no matter which plan or path you choose, whether you get the Medicare Advantage plan or the Medigap. They're all organized in this very same way in compliance with Medicare. So each plan will have its own unique formulary. And now that might be a term that you're not too familiar with, and it simply means list of drugs. So each prescription drug plan will have its own unique formulary. So each plan will take all their prescriptions and divide them into these 5 tiers. Now, tiers 1 and 2 are your preferred and non-preferred generics, usually the least expensive. Tiers 3 and 4 are your preferred and non-preferred brand. The cost goes up a little bit there. And then tier 5 is your most expensive. These are your specialty drugs and your injectables. And if you're taking one of those prescriptions, you probably know it already because they can be quite expensive. So the thing that makes it kind of confusing for each of you is that each prescription drug company can take the prescriptions that they have on their formulary and assign them to the tier of their choosing. So let's take Lipitor, for example. One company might put it as a tier 1, and it could be very, very inexpensive, whereas another one might put it as a tier 2 or maybe even a tier 3. So this could be really confusing unless you have an advocate, which you do in VIA Benefits, and access to the prescription profiler, which will take your specific prescriptions and compare them to all the different plans to find the one that is the best price for you. So it really does keep your costs down significantly to have that flexibility with your prescription drugs and able to choose the plan that's the best match for you. Now each year as you renew your prescriptions, Medicare is going to track the retail value of your prescriptions. So if you select a plan that has a deductible, then you will pay the full retail of that prescription amount until the deductible is met. So there are many different ways to have a $0 deductible, and the deductible can be anywhere in between $0 and $480. So there are some plans that have a lesser deductible, somewhere in between. Once that deductible is met, then you go into the second level, which is called initial coverage. And this is probably more similar to what you're used to with your group plan, where you pay your copay and then the plan pays the rest. And most of you, this is where you'll be the majority of the year, if not all the year. It takes quite a few prescriptions. You have to get up to $4,430 retail. So remember, that's not what you've paid, it's what the retail value of your prescriptions is. Once you reach that amount, then you go into the third level, and about 25% of you will have costs that take you into this third level, and this is called the coverage gap or the donut hole. Now, no longer is the donut hole as expensive as it used to be. Now, instead of paying your copay, you will pay a coinsurance, which generally is right around 25%. So your costs may adjust a little bit, but usually it's not too bad. Those of you who reach $7,050 retail, That will take you to the 4th level, which is catastrophic coverage. Now, this is a safety net that Medicare has built in for people that have high prescription drug usage and costs. So once you reach the 4th level, you get $3.95 for your generics, $9.85 for your brand name drug, or 5%, whichever is greater. Okay, so usually about this point, I stop and take a deep breath and let people kind of get over their deer in headlights look, because I know this is a lot of information. And just to remind you, this is not your only chance to hear it. Most of you, like I said, will just be in that initial coverage, and it'll just be same as you're used to. But if you go into the coverage gap or into catastrophic coverage, those 3rd and 4th levels, I really encourage you to strike up a friendship with one of our benefit advisors, because they will really be a great resource for you in how to get the prescriptions that you need at the best cost. All right, with that, we're going to talk about the VIA benefits process. So 3 simple steps: prepare, review, enroll. The way that we do this is we encourage you to gather up by the phone or by your computer, whichever way you're planning to shop. You'll want to gather up your Medicare card once you get it. Okay, so you'll apply for that about 3 months ahead of your birth month or your retirement date, and then you'll have your Medicare card with the 4 important pieces of information that you'll need to enroll in a plan. You'll want your doctor directory, especially if you're thinking about going into a Medicare Advantage plan, because we want to make sure your doctor participates in the network. And then you'll want to have all your prescriptions gathered up from around the house. So if they're, some in the medicine cabinet, some in the kitchen, some by your bedside, gather all those up so they're right there handy as you complete your personal information into the system. Now, remember that prescription profiler. That's the tool that you'll put your prescriptions in and then hit the enter button, and it'll sort through all your prescriptions that you take and compare it to the plans available to you. And so that's why we ask for you to have those prescriptions handy. So either you can go online and put your information in, create your account, or you can do that with your benefit advisor, or you can have your computer up as you're talking to your benefit advisor. But you go and put that information in. That's the first step. And then you schedule your appointment. So either with your benefit advisor, you can do that on the phone, or probably faster and easier even is to do it online. Super easy right there. Now, right now we are in the open enrollment period, so I do want to talk about that for just a little minute to help you set expectations. So we know that we're talking to folks that are going to be retiring or turning 65, possibly even up as far as a year out. So after the open enrollment period is a wonderful time to make your appointment and work with a benefit advisor if you can, if you have that window of time to give you some leeway there. Because right now we get really popular. That being said, if you are turning 65 or retiring in like February, back up from that, so that'd be January, December, November. Okay, so right now would be when you would need to do it. So we do want you to know that we are here and wanting to help you every step of the way, but closer to your enrollment period is better if it overlaps with the open enrollment period. You will get, just in time, about 3 months before you turn 65, or if we know you're retiring, we'll send out this enrollment guide. Nicole mentioned it earlier, lots of information there, and actually a lot of the information that we're covering today. So you'll have it there in writing, so just another way to hear this information. I would encourage you, if you're a few months out from enrolling, that you might even want to re-listen to this presentation that will be posted on the website. And so once you have all that information available for you, you'll want to start to review the plans available to you. Now, right now, we just have gotten all the 2022 plans, so those are available. And so you can actually look at these plans online very simply. We have a tool called Shop and Compare. So just like we had that Medigap chart that showed you all the lettered plans side by side, now the Shop and Compare tool will do that very same thing for you with the Medicare Advantage plans. So you can pick up to 4 different plans that you're considering, and you can look at them line item by line item to see which one is the better deal for you. Keep your costs where you want them, and has the benefits that you want as well. As you are looking at these Medicare Advantage plans, you'll want to consider the optional benefits. So you'll see that box right here that has the available hyperlink. And this will tell you what kind of benefits the Medicare Advantage plan that you're considering has. So you can check that out and compare as well. And then we have a tool called Help Me Choose. So you just answer a few questions and then press the button, and the system will make a recommendation which plan will best meet the needs that you are looking for based on your answers. And then this tool is the Prescription Profiler. And it's right there too with all these others, and you can put in your prescriptions, just your current ones. Don't worry about anything that you're not taking anymore at this time. You can do another pass through and put in those prescriptions so you can see which plan would be recommended if you did have to take that prescription again. Sometimes that information is helpful, but keep it current prescriptions only the first time through to get the best recommendation on which plan you should enroll in. Be very accurate. If there's little letters or numbers at the end of the name, make sure to include those, and make sure that your quantity and frequency is accurate too, because sometimes you have to take one tablet a month, and if someone puts in 30, that will definitely skew the results. So make sure everything's very accurate, and if you're working with the benefit advisor, they may want to go over this again with you real quick to make sure everything's accurate so that you get a really good recommendation. So here is our pre-enrollment checklist. So you'll want to set up your appointment with your benefit advisor to have your pre-enrollment consultation. You'll create your account online, so you'll want to put your doctor information in there and your prescription information in there. The doctor information maybe not so important if you're thinking you want that Medigap. And then you'll be able to do a complete needs analysis either online or with the benefit advisor, and determine which type of plan you prefer. Now, you probably already have a really good idea if you want that Medicare Advantage plan with the really nice low costs and a really good network in place to give you the care that you need. Or maybe you're thinking, no, I'm going to be traveling a lot. I want that portability. I want a healthcare that travels with me. These are the types of things that you'll want to consider as you choose your plan type. And sometimes I think a really good question to add to that as you're contemplating that is, what kind of coverage would I want to have if something were to happen? Because how you feel about it right now might be different than if you found out that you had some kind of serious condition pop up. So if you're the type that wants to, go to the best doctors in the whole country, you probably want a Medigap. If you're the kind that wants to be close to home and that you know that your network has the doctors that can cover these conditions, and most of them have really great doctors and can cover most any conditions. And so if that's how your comfort is, then Medicare Advantage plan might be a great option for you. Okay, so these are the things to consider. And then you'll want to ask yourself, okay, do I want to enroll with the benefit advisor? And they're happy to do that for you and very good at it. It's kind of like having a private secretary. I would say give yourself a minimum of 45 minutes to work with the benefit advisor, find the plan that you want, and get your enrollment done. Now, if you already know what plan you want, some of you might say, oh yeah, I want that Plan F, I want the least expensive one, and done, decision made. You may want to just enroll online, because that once you get that plan, you just click on it, put it in the cart, and then start your checkout, and within 15 minutes you will be enrolled in your Plan F and on your way. Okay, so if it's a simple thing, you may want to consider just doing it that way. But either option is great, and the benefit advisors are there as your resource to help you make that good decision. Now remember, if you're a newly eligible, the Plan G is the most comprehensive. About 93% of our plans are able for you to go start to finish and enroll completely. If you choose one of the 7%, you may have a little button that pops up and says, please call us, in which case you'll just dial that number and then we'll help you wrap up real quick. Doesn't take very long. About a week after you've enrolled in your plan, you'll get a selection confirmation letter. And so these are always well received. It's nice to know that, yes, you did indeed enroll in the following plans. So just give them a once over. If you see anything that wasn't exactly what you were thinking, you want to give us a call sooner rather than later. No matter whether you enroll with the benefit advisor or enroll online, you still will get one of these selection confirmation letters. Okay, this is not your acceptance into the plan. However, you will get a packet, a mailing from each of your insurance companies that you enroll with, and you'll have your card, your schedule of benefits, your evidence of coverage, everything with that plan will come in a separate mailing. But not to worry, right now you have that golden ticket as you're aging in to Medicare or retiring and coming off of the group plan. So not to worry, you will be successful in enrolling in your plan. And we are here not only during this transition, but also ongoing. So anytime you need an advocate to help you with your Medicare, you've got our number, right? I would go ahead, if you've got your cell phone there, just take a minute right now and put that phone number into your cell phone, or if you've got a landline, you could do it into your speed dial, 888-598-7545. And that way you've got that number handy to call us whenever you like, and you don't have to go looking for your paperwork. Okay, so you'll see this number again. It'll be on the last slide when we're done as well. So if you need to grab your phone or send somebody to go get it for you, be sure to do that. Get it into your speed dial. So we're going to take a minute now to talk about that continued funding from PEB. Okay, your Health Reimbursement Arrangement, HRA. They are still vested in your health care as a retiree, and it's just in a little different format. And Nicole is going to kick us off with that. So I'll drop off while she talks for a second.
Thank you,
About 3
Debbie.
slides, I think. Yeah.
That was a lot of good information. Okay, so there are two different types of HRA funding as a retiree. The first type is if you are enrolled on the consumer-driven health plan. So this would be for those of you who either have dependents on your plan, or you were ineligible for Part A, so you're staying on a PEB plan, or maybe you even have TRICARE. So all of you would be staying on a PEB plan. Now, if you choose the HMO or EPO option, that doesn't come with any HRA funding. This is only for those who are on the consumer-driven health plan. It is funded on an annual basis, just like it is today on July 1st. This year it is $600 per participant with no additional funding for dependents. However, that does change every year. Once you do transition over to VIA benefits, the remaining funds are no longer available. So what does that mean? If you're currently on the consumer-driven health plan and you have a Healthscope Benefits debit card, you might have an HSA or an HRA. You will want to determine which of those two accounts that you have because that's really important. If you have an HSA, that money stays with you. So when you transition to VIA benefits, you can still continue to use that money with that debit card. Healthscope will send you a new debit card if your card expires. However, if you have an HRA, that is the state's money. It's considered the state's money because you weren't able to make any contributions. That money will revert to the state when you transition over to VIA benefits. So if you're not sure which one you have, go ahead and contact Healthscope Benefits. You can also contact PEB and then we can transfer you to Healthscope. And any money that you have on that card will roll over from year to year. And you are encouraged to use it because like I said, when you leave the plan, that money doesn't stay with you. Now the second option is the VIA Benefits HRA. Now this will be for all of those of you who transition over to VIA Benefits. Yours will be funded on a monthly basis and it's funded according to your years of service and your date of hire. So if you were hired from 2010 to 2012, you need at least 15 years of service to even qualify for HRA funding. If you were hired after 2012, you will not qualify for any HRA funding. And as of May 31st, 2021, there has been a cap placed on the amount that will roll over from year to year. A lot of questions we received about this slide was, will it be similar to the debit card that you receive now? Will the funds be placed on a debit card? And they will not. It is going to be different. The next couple slides we'll talk about how you can be reimbursed with your HRA funding, but you will not have that debit card. So how much will you be funded? Let's go ahead and look at the next slide. And on this next slide, you'll see how the funding starts at 5 years of service and then caps out at 20. We don't take any bot years into consideration, and this is all monthly. So let's say, for example, you have 18 years of service. You will be receiving $234 a month. You can use that for premiums or eligible medical expenses. PEB will automatically establish your HRA funding. There isn't anything that you need to do as long as you enroll in a plan through VIA Benefits. Once you enroll in the plan, VIA Benefits will send you a funding kit, a funding account welcome kit, and that will just show you or tell you that your funding has begun, which normally takes about 6 to 8 weeks. Next slide, please. Okay, so this is what your funding kit looks like. This basically just tells you that you must stay enrolled in a medical plan through VIA Benefits in order to continue to receive HRA funding. This is so important. So if you are approached by an outside insurance agency or you're receiving mail that says, you know, your plan is about to end, you must take action, please contact VIA Benefits and deal with them directly, because if you do accidentally disenroll in a plan with VIA Benefits, you will be disqualified for HRA funding. You will also lose your basic life insurance and PEB dental and any voluntary products that you may have enrolled in. Next slide, please. Okay, so Debbie, I think this is where you take over, so I'm going to go ahead and pass it back on over to you.
Thank you, Nicole. So yes, to pick up where Nicole left off, I like this back and forth. This is great. your health reimbursement arrangement. I want to put an emphasis on that second word, reimbursement. This is the part that's new. So you pay your premiums, for example, upfront, or your healthcare expense, your out-of-pocket, only your copay or whatever is along with your plan. You don't have to pay for the whole doctor visit, just what your plan requires. And then you can get reimbursed for these costs. It is a tax-free account. So you can mention it to your accountant, but generally you do not have to pay taxes on this. So that's a wonderful thing. And then you will have your allocations once you are eligible and remain eligible. PEB will make a monthly contribution to your HRA account. Now it is a notional account, so it stays on the books with PEB until such time that you make a reimbursement request. So important to know that the funds remain with PEB. And then you may use these funds up to the full amount of your allocation to reimburse yourself and your spouse for eligible medical, prescription drug, dental, vision, Medicare Part B premiums, as well as eligible out-of-pocket health care expenses. Now you want to be current with this. You cannot do costs that were incurred over 365 days ago. Well, that's a full year. So it's not that you lose any money, it's just that you need to use current receipts in order to access these funds. Your HRA account is typically created within 6 to 8 weeks after you are qualified. Okay, so there will be a little bit of a lag in the front to be aware of. Any unused HRA funds at the end of the month just roll into the next month, and then when you get to the end of the year, it just rolls into the next year. But as Nicole mentioned, there is a cap now for $8,000. We encourage you to try and keep your account zeroed out every month. Take advantage of this benefit. You know, don't think of it as a nest egg, because if something happens to you, this does not become part of your estate. It reverts, it just stays with PEB. So not something that your children would inherit or anything like that. So definitely take advantage of this benefit. Try and zero it down each month so that you get full benefit of those funds that PEB intends for you to benefit from. So we're going to talk about how the HRA works. Now I know this is a bit of ways for most of you, and this might be your first exposure. All this stuff that I'm going to tell you about it is way more complicated than what it really is. We have got this so simplified, and I can sum it up in 3 words: automate, automate, automate. Okay, that just makes it easy for you not to be doing paperwork and not spending a lot of time fussing with this. It can be very simple. So the way it works, number 1, is you make your premium payment or pay your provider for your out-of-pocket expense. Then you'll submit a reimbursement request. You can either do that by the mobile app, your online account, by mail, or by fax. These are all possible options, but the easiest way is automating it. And then step 3, Via Benefit approves it and makes sure it's all compliant with the IRS rulings, and then reimburses you for these funds up to the full amount in your account. 3 different ways that you can get reimbursed. Okay, so number 1 is that automatic reimbursement. And about 90% of our plans are able to support auto reimbursement. If you choose a plan that cannot support auto reimbursement, no worries. Option number 2, I like to call that semi-automatic, because you only fill out a reimbursement request once a year in January, and then it's good for the full year. So that makes life really simple. And then number 3 is the one-time manual reimbursement request. Okay, so if you have a $0 Medicare Advantage plan, then I do encourage you to go ahead and get your Part B in place, so at least you get that chunk of money coming each month for you. And so you may have to work with the benefit advisor to figure out the best way to access those funds so you don't run the risk of building up too much of a nest egg. Now, this is how the auto reimbursement works. Picture's worth 1,000 words, so let's have a look at this. So you will set up your automatic withdrawal with your bank to pay your insurance provider, and that's the first step. Then the insurance provider will let Via Benefits know that your premium payment has been made, and then we'll do our due diligence on our end, and then we reimburse you. Now, the default way right now is for us to send you a check, but I really encourage you to set up direct deposit for all your reimbursements because it's faster, safer, more secure. We have a lot of reconciling that we have to do with checks that are not cashed, and that is no fun for anyone. We want you to get your full benefit. So setting up direct deposit guarantees that. And then this just cycles from month to month. So auto pay, auto reimbursement, direct deposit, and you get your reimbursement from month to month. Now, brand new, you're coming in at a great time. You may now automate your Part B reimbursement if you have a medical plan with Via Benefits. And so to activate that, all you have to do, 3 ways you can do it. Either call us, or you can activate it on your online account, or you can also do it on the mobile app. So I'll talk about that in a moment. So 3 simple ways to turn that on, and that $148.50 right now, probably going to go up $10 for next year. That will automatically be reimbursed for you once you turn this on. Okay, so this is really a great way to go. Now, if you have to pay more or less than the standard amount, you can fill out that number 2 option, the recurring claim form, for your exact amount. But for most of you, that's going to be the $148.50, and you don't have to do anything for that. If you have TRICARE and you have an exception, then this option is not available to you. We are simplifying things, so now there is only one reimbursement form that you use for everything that you don't do automatically online on your account. Okay, so that's what this form looks like. See the barcode up in the upper right-hand corner. You'll want to make sure to only be the one to use this form because it is specifically identified for your account, so you don't share this with anyone. But you can use this form for any out-of-pocket things that you would like to be reimbursed for that are eligible. So maybe things like you got a new pair of glasses, or you bought some hearing aids, or you're getting some contacts or some dental work. I encourage you to use this for big ticket items. That way you're not spending a lot of time doing paperwork. Some people just have it in their head that they want to be reimbursed for their prescription drug costs, and so they'll be filling out these papers and providing receipts for like a $25 prescription here and a $15 prescription there. That's just too much paperwork. So if you can avoid that, we really encourage you to, number 1, automate your premiums, and number 2, request to get reimbursed for big ticket items. Okay. But like I said, this is a ways down the road, so not to worry too much right now. Schedule 213D, D Delta from the IRS has a complete list of all the things that you are eligible to be reimbursed for. So lots of different options to choose from, and our goal is to help you get full benefit, full access to your HRA account. Once your account is funded, and generally it's 6 to 8 weeks from the time you enroll in your plan, then you'll want to set up your online account, and you can go there to do your direct deposit, to automate your reimbursements. Everything is paperless now, And we've had so many of you PEB retirees ask us, please, can we do everything paperless? Very green-minded community, and we appreciate that, and we're very excited that we are there now. Everything is green for you. You can submit your reimbursement requests on your online account, but the easiest way to do it, which I like to recommend, is download the app on your cell phone. It's good for your Apple phone as well as your Android. And once you download that onto your cell phone, you'll be able to see how much you have left in your account at any given moment. You can check where your reimbursement's at, when to expect that. You can submit new reimbursement requests, and you can actually use your camera to take pictures of your receipts and then submit that. So really fun and new, easy way to manage your account, everything right at your fingertips. So I have now a few different plans, examples in each of the 3 different areas for you to look at just to get an idea. These are 2022 plans, so these are the plans if you're going to be enrolling that you will choose from over the next year. And we'll start with Clark County in Las Vegas. Very robust medical community, highly competitive, one with another for your business, which is to your advantage, of course. 36 different Medicare Advantage plans through Humana, Aetna, AARP, Anthem Blue Cross Blue Shield, Senior Care Plus, WellCare, Select Health, lots of choices. 19 different $0 plans. Okay, so more than half of the 36 are $0 plans. So these can be very robust, wonderful plans. As long as your doctor participates in the network, I think you'd be very happy on any of these plans. I hear really good feedback about most of them. $0 up to $152. So with a Medicare Advantage plan, if you're paying a high premium, obviously it's going to have some extra benefits included. But most of them are very inexpensive. 13 different Medigaps, going from $64 up to $277. Now this is for a 65-year-old male, because we know most of you will be 65. There may be a few younger than that on disability. But $277, the most expensive Plan F, does not have any more benefits than the least expensive Plan F. And so I'll show you what that amount looks like in just a second. Now I want to talk about the Part D plan. With your Medigap, you have a lot of flexibility to choose the plan that's going to work the best for you. I want to mention that $7 plan that's listed here. This plan has a $445 deductible, but it makes an exception for Tier 1. And on their Tier 1, they have the 100 most common prescriptions available at a $0 benefit. Okay, so this is a nice basic plan. Might be good for someone who maybe just takes a generic or 2 and doesn't have many prescription needs. Rather than not have a prescription drug plan, which you can do, but then if you ever changed your mind later on and decided that you did need a prescription plan, you might be eligible, or you might be penalized 1% per month for the period that you did not have a plan. So this is a good option for people that don't have high prescription drug needs. Good place to start your review phase. Now, with your all 3 counties, Clark, Washoe, and Carson City, you'll be able to talk to the benefit advisor or enroll online for vision plans and dental plans if, as Nicole mentioned, if the group plan is not meeting your needs, there are several options to look at, 14 different plans, and really quite cost effective. They're not quite as robust as the PEB group plan, I think you get like 4 cleanings a year, which that's pretty exceptional. But most of these have at least 2 and might be a nice alternative for some of you. Okay, so in Clark County, there is a PPO for $0. We actually have a $0 PPO in all 3 areas. So really good, robust options, and has a $0 deductible. If you go to your doctor, $0 copay. If you go to your specialist, you don't need a referral with a PPO, so you can go see their specialist, and $30 in this network. Days 1 through 5, $300 per day as you have to use your hospital benefit. Now, one thing that's really popular that is really being offered and used a lot these days, especially with the advent of COVID, is the telehealth. And on this plan, you can do telehealth for $0 up to $40 copay per visit. So really a nice, inexpensive, convenient way to talk to your doctor, get things taken care of, and be safe. Included in the Medicare Advantage plan is the prescription drug plan. It has a $0 deductible. So you go right into first dollar benefit. And as you can see, your generics are going to be $0 copay, both at the retail location and then also mail order to your home. So really a nice option. Least expensive plan F in Clark County is $207. Okay, so quite a bit less than that most expensive one, and has all the same benefits. And I coupled this for the example with that $7 prescription drug plan. And so it's $214. So if you've worked 20 years for PEB, you have a nice HRA amount to more than cover the premium and for both your medical and your prescription drug. So this can be a very affordable option for you. And then look at that nice long line of zeros there, all the way down with the Plan F for those of you who are grandfathered. And that $7 plan is a nice option for your prescription drugs. Now, looking at the Plan G for those of you who are newly eligible, the Plan G Innovative Plan has a few extra benefits than just a straight G, and they are available in this area. So might be a nice plan to look into. $158 for a 65-year-old male non-tobacco user. And just to show you the far end of this, a $0 plan is available for $64. Now that's probably more of a premium than most of you will have to pay, but this is the far extreme example of what you would pay for a $0 deductible plan. So add that together and it's still only $222. So still very affordable. And then first time you go to the doctor with your Plan G, you would pay in 2021, you would pay the first $203, and then in 2022 you'd pay the first $217 to meet that deductible, and then everything else is covered just like a Plan F. Okay, so little to no out-of-pocket expense with these nice Medigaps. All right, Carson City. Carson and Reno are going to be fairly simple. Little less number of plans, but still really robust, excellent plans available, and lots of choices. 17 is actually quite remarkable for that community. And $0 up to $180, 13 different Medigaps, 17 different prescription drug plans. There is that $0 PPO. This one does have a $1,000 deductible, but there's other plans that do not have a deductible. So you can look at that as well. $0 when you go to your doctor, $30 when you go to your specialist, $350 for the first 5 days in the hospital, and then $0 after that up to 90 days. In this being a rural area, telehealth is really a nice plus. And so working with any of your in-network doctors, there's no charge for it. So that's a really nice benefit. And then $0 for your deductible, $0 for your preferred and non-preferred, both at the retail and on mail order. So very cost-effective plan, really nice. Now 168 is the least expensive plan F, and 141 is the least expensive plan G in Carson City area. And now we'll look at Reno real quick. 21 different plans, so a few more, a little bit bigger city, and lots of different carrier options, 9 different $0 plans to choose from. And we've got 13 different Medicaps going up to 248, 17 different prescription drug plans, and a $0 PPO. Lots of $0 plans to choose from in all 3 areas actually. So you'll have a $0 deductible, $0 when you go to the doctor with this plan as well. Similar costs, similar information all the way across for Reno as well. 168 for the least expensive plan F, 141 for the least expensive plan G. It's also an innovative that has some additional benefits as well. Okay, so that should give you a good idea of what to expect when you're looking at plans over the next year. Usually prices don't change too much throughout the year, although there's always a little asterisk that they are subject to change. So right now I'm just going to make our last call for action here. You'll gather up that little box or basket by the phone, get your Medicare card, all your prescriptions. This says prescription list, and I think that is what it says in the mailing, but I really recommend that you get the actual vials and have them there so that when you're working with the benefit advisor, if they have a question, you'll have that vial right there to get the right answer. Your doctor directory, all the facilities that you like to use. And I like to add to this list, also have a pencil and paper so that when you have a question, you can just jot it down and you'll not forget it when your appointment time comes and you have a chance to talk to your benefit advisor. All right, and here, as I promised, is that checklist that Nicole went over earlier. So you'll want to 3 months before your 65th birthday or your retirement. Now you can defer, as Nicole said, as long as you're actively working and on the group plan, you can defer until you're ready to retire and coming off of the group plan. So not to worry about that, you will not be penalized. And so if you've had a chance now to take a snapshot of your checklist here, I will come back to that if you want me to in a little bit here. And then this is also another good picture to take. This is all your contact information for PEB, for VIA benefits, and also for Social Security so that you have all the numbers you need right there handy. And with that, I would love to invite Jason to come onto the line. Jason is our wonderful tech host that keeps everything running smoothly for us. And he is going to look at your questions that you've typed in, the most common ones. He's going to share those with us. And we'll have a short Q&A at this time.
Thank you, Deb. We have some great questions here starting to come in. Just as a reminder, if anyone connected has any questions, feel free to type them in and we'll get to them in the order we receive them. Looks like we have someone already responding to this question here. Maybe if you have any final advice or something you can share, Deb, while we're waiting for some more to come in.
Okay, yeah. One thing I usually like to talk about is authorized representatives. Okay, so when you have your enrollment appointment with the benefit advisor, If there's someone that you want to help you with the transition process, just let us know who that person is. Like at my house, my husband lets me do all this kind of things, so he could set me up as his authorized representative. So if you have a similar understanding at your house, but maybe you have a child or grandchild that's, in the healthcare field, or an accountant, or, really good at this kind of thing, kind of your medical support person. Maybe it's just a good friend or someone from the church. Whoever you would like to help you with this, let us know. We'll set them up as an authorized representative. They will need your HIPAA information, so that would include your full name, your birth date, and your telephone number, because we are required by Medicare law to verify each phone call before we talk about your personal information. So they would have to have that information to be able to speak with us, and your permission in advance as well. Now, when it comes time to enroll, only you or one other person, and that would be your durable power of attorney with the authority to make medical decisions. Only those two individuals are able to actually enroll you in a plan. So authorized representative is not that. They can help you with all the review process and help you make the decision, but unless you've got them designated as your durable power of attorney with authority to make healthcare decisions, you would have to be on the call to actually enroll. Okay? That goes for your spouse. 50 or 60 years of marriage does not qualify you as a POA, so unfortunately. So do you have a question for me now, Jason?
Yes. All right. So this first question, they're saying, I'm retired. I'm working part-time for the state still. Do I still need to go on to Medicare at 65, or can I stay on the current PPO plan?
Okay, so say that again. You're retired, and what was the next thing?
And still working part-time for the state.
Still working part-time for the state. So I think I'm going to defer to Nicole to answer this question. It's a little more complex with their policies.
Yeah, so if you're working part-time, I believe that you do not have to sign up for Medicare, but I could be wrong. I don't know for sure. I will look that up, and I will get that answer to you all before our meeting ends.
Okay. And they can always call your benefit desk, right, Nicole?
That's true. That could be easier too. If they want, they can just go ahead and call PEB Benefit Desk, and then
Yeah,
they
and
will
then
answer
they'll
that
have
question
all
for
the
you.
resources at their fingertips to look into those kinds
Yes.
of questions.
And that's 775-684-7000, option number 2.
Okay,
Yep,
there's
right
that
there.
number right
Thank
there.
you.
Okay, good question.
Thank you. Another question here. So they're saying the husband is primary. I'm the spouse. He turned 65 last year, enrolled in Part A and Part B, and kept same insurance since I don't turn 65 till June. They're saying that they live out of state. Now, does he need to enroll through VIA Benefits during the open enrollment, and then they do it 3 months, and then the spouse does it 3 months before they turn 65? Question mark.
Okay, so a lot of pieces to that. I want to talk first about the moving part, if they live out of the state of Nevada, and then I'll defer to you, Nicole, to answer the rest of that part. So VIA Benefits represents all our 120 different carriers throughout the 50 states. So we have plans wherever you may move. So those of you who have moved or are thinking about it, once you get into your new location, you'll just give us your new updated information. We'll share that with PEB. Very important for us to be able to stay in touch with you. And then you'll be able to schedule an appointment because you have a new golden ticket. If you've moved outside of your network. Now, if you have a Medigap, you can go anywhere in the 50 states, right? So there's no network. So you would just go to your new location, give us your address, and then we would You'd let the insurance company know that your new address as well. They may adjust your premium a little bit if you moved into a lesser expensive area or a more expensive area. So there may be a little bit of an adjustment there, but with Medigap, it travels with you wherever you go, so including moving. And Nicole?
Yeah, so I'll answer the other part of the question. The husband would not have to enroll with VIA benefits until 60 days prior to the spouse turning 65 in June. And that could be before or after. So sometimes participants get a little bit afraid that they won't be able to make it in that deadline because they don't have their cards yet or what have you. So it's before and after.
Okay, thank you, Nicole.
Thank you. Next question I'm seeing here, they're asking how many credits are needed to be eligible for Medicare?
Okay, so when you are coming into Medicare, if you have worked 40 quarters, so that basically is 10 years, then you have earned your Part A at no premium. Now, if you've not worked but your spouse has, or a former spouse that you have been married to for 10 years, you can benefit from their Social Security benefit. Okay, but it's 40 quarters, 10 years.
Thank you, Deb. Another question here. So hypothetical, they're saying that if the primary passes, can the spouse stay on the PEB coverage? Or will it end for them also?
So Nicole, I'm going to let you address that one too.
Yeah, can you say it one more time, Jason?
Yeah, so if the primary deceased or passed on, what would happen with the spouse and their coverage?
Okay, so they would be considered a surviving dependent. They do not qualify for HRA funding, but when they are Medicare eligible, they do the same thing. So PEB's Medicare requirements apply to the spouses or domestic partners. So they would sign up for Medicare and then they would enroll through a plan with VIA benefits.
Yeah, and we are your advocate through whatever situation, whatever happens with life. We are not going away, so we will help you with your plan choice and all your Medicare navigation needs ongoing. And based on the relationship with PEB, even though the HRA is not there, you would still have our full advocacy.
Thank you, Deb. Thank you, Nicole. Next question I'm seeing here, they're saying they've been retired since 2016 with 36 years of service. They don't think they're eligible for Part A since they don't have enough credits. Will they stay state funded? And then a part two to the question, they're asking, would they need to call Medicare to see what their credits are at?
Okay, so yeah, definitely that's a good first step is to check with Medicare. Also look at your spouse when you're talking to Medicare, check if your spouse has enough credits as well. If not, then just call the benefit desk at PEB because they have that alternate plan that Nicole outlined for you. They'll help you understand how to access that program. Okay.
And you will
Go ahead.
You will also continue to be funded. It's just a little bit different when you're not eligible for Part A because you're only given HRA funding if you are on the consumer-driven health plan. So that's just something that you can think about when you are selecting your plan.
Excellent, thank you. Now this is something, another question here, they're saying, is there an advantage for me to sign up for Part A now, but not Part B as an active employee? They're worried about when they can be asked those extra questions.
Yeah, so Nicole did cover that in her comments. You want to just, well, Nicole, do you want to just repeat what you'd said earlier?
Yeah, of course. So basically, we did have a couple questions regarding this matter. You can sign up for Medicare Part A. It's just if you are on the consumer-driven health plan and you have an HSA, then I would recommend that you wait. Now, let's say you're on another plan. Great, you can sign up, but let's just say rates change and the next year you decide, you know what, actually I want to switch plans. I want to go to the consumer-driven health plan. Just keep in mind that once you sign up for Medicare, you're no longer eligible for an HSA. And once you sign up for Medicare, you do have to send PEB a copy of your Medicare cards.
So it would limit their options going forward.
Correct, yes. But for some people, they crunch the numbers and they don't see anything wrong with signing up early or signing up when they're 65 and still active. So it really depends per dependent and what plan they're on.
Great.
Thank you. Next question here. They're saying it looks like I can save more by going with VIA than staying on the PEB health plan. They're saying, is this correct?
So as a blanket statement, I wouldn't want to say yes or no on that because it really does depend on a lot of different factors. So if you want to talk to a benefit advisor, go ahead and make an appointment and they'll help you look at all the Medicare math to determine. It really depends what kind of plan you're choosing and what your home situation, your health, your lifestyle, which plan you would want to choose. So I would definitely make an appointment with a benefit advisor to have that conversation.
Looks like...
Oh, I was just going to add one more thought. We have $0 plans. It's hard to beat zero. And with a HRA benefit, as most of you have, usually the costs of the premiums are reimbursable for you. So yeah, hard to beat zero.
Yeah, it looks like I just have a final follow-up to that same question. They're just wanting clarification on knowing when they can ask those questions as it relates to when they sign up for Part A. Does it matter?
What questions are they referring to? Ask those questions. I'm not sure. Are they talking about pre-existing conditions?
Yes, pre-existing conditions.
Okay. Yeah, pre-existing conditions. If you are coming off of the group plan and it's your first time into Medicare, they will not be able to ask you any medical questions. You do not have to do medical underwriting. You have that golden ticket that guarantees you the plan of your choice. So that includes not only Medicare Advantage plans each year during the open enrollment period, but also the Medigaps. So yeah, we love those special election periods.
All right, looks like another question here. If your younger spouse anchors you to your PEB plan, what is the best way to compare staying on once you turn 65 versus enrolling with VIA? Do you want to talk with PEB first or the VIA advisors?
Yeah, probably the best thing to do is find out how much it would cost for your spouse if you did leave and go to Medicare, because their costs would go up. Isn't that right, Nicole? They are unsubsidized once
that is correct.
retiree leaves. Yeah. So most people, it actually works out better to wait and move together. But if you want to work through those numbers, I would start by looking at the number that it would be for your spouse and if you have other dependents. See what their costs would be and see how that compares to what you're paying now. And then you can either go online and look at all the costs there on what type of plan you're thinking you want, or you can work with a benefit advisor. Either way. Benefit advisors, I mean, they do this all day, every day, so they're really good at this Medicare math.
Thank you. Next question, they're saying they're retired with no dependents. Does my husband still affect my Part A eligibility if I don't have enough credits?
Yeah, so if your husband has enough credits but you don't, that's an additional benefit of being married to that wonderful man.
All right, looks like there might be 1 or 2 questions still to finish up in the questions box at this time. So if you have anything to...
Yeah, we had a really fun question yesterday. Somebody asked, how does GoodRx compare to your group plan? So maybe that's a good filler to use. I don't know if you've heard of that little card you can get from GoodRx. That actually can give you discounts and coupons for a number of different prescription or pharmacies around the area where you live. So you might want to look into that. Your group plan, we have that prescription profiler, so we're getting your costs down as low as we possibly can with the insurance plans. That's our goal as we help you select your Part D plan. But a coupon with an extra discount on top of it can't hurt, right?
Hey, Debbie.
Yes.
This is Stacy.
Hi.
Hi. The GoodRx, though, you can't submit those for reimbursement. Just to
Oh,
let
thank you for
people know.
adding that.
Yes.
Yeah. So you mean if they get a discount, they can't get reimbursed for what they paid?
For the prescription, yeah.
Yeah, but remember
not
you don't
eligible.
want to get reimbursed. That's too much paperwork anyway. So get
Yeah.
reimbursed for your premiums and use your GoodRx if that makes sense.
Right.
I know I
just-
used that one time with my mom, and I think we saved like $2 was all. So sometimes it sounds better than it is, but you know, it's kind of a fun thing to look at.
Mhm.
And thanks for that feedback, Stacy.
Hey Debbie, this is Chris. Can you go back 2 slides to the instructions,
Mm-hmm.
the action? That was a question that came up earlier.
Okay, yeah. If you've got your camera handy, this is kind of a good slide to be able to follow. Say, yep, I did step 1, now I'm on step 2. And if you don't have your camera handy, if you miss the chance to snap a shot of this, remember it will be posted online. And so you can stop and start and do a screenshot on anything that's in this presentation once it's online.
All right, we do have a couple more questions here we can pop in with. Next question here is VIA advocates only for state employees.
So we are your advocate, whether you're state or non-state. We can help you with your plans. We can manage the HRA if you qualify. So no, the advocacy is for all PEB retirees. So please feel part of the family and welcome to take advantage of all the resources available.
Thank you, Deb. Another question here. What happens if I do not enroll in VIA benefits within 60 days after I do turn 65?
Okay, so if you have an HRA, you'll want to make sure that you enroll within the time that's allowed to still remain qualified for that HRA benefit. So before you make any decisions like that, I would for sure talk to at least the benefit desk over at PEB to consider your options, and then absolutely you can talk to a benefit advisor and just look at the opportunities that are available to you if you do go this direction. We'd hate for you to make a decision not knowing all the details. So I do encourage you to have those 2 conversations before you make any decision like that.
All right. Well, at this time, we don't have any other questions in the questions box. So if you have anything you want to close with, now's a
Okay,
good time.
I do. I want to thank everyone for joining today. I know this is a lot of information. There have been a lot of topics that we discussed, and just a reminder, this is not the only chance you'll have to hear this information. We actually do have these meetings spring and fall, 2 different days. So you know, if you're not retiring and moving into Medicare until after the spring, probably sometime in late March, early April, we don't have exact dates yet. But watch for additional meetings if you're still in the transition process. You can join us for those. If you do transition between now and then you'll want to attend one of our HRA meetings. That helps you once you get into your plan on how to understand how to access your HRA benefits and all kinds of information on any changes for the year, things like that. So we love working with you, and we really look forward to the opportunity to help you with this transition. Again, I know it's an exciting time of life, time that you look forward to for a long time. And so we want to keep everything as simple for you as possible, help you get into a really great plan going forward so that you can just enjoy your golden years and have that peace of mind knowing that you have a great plan and that you're well supported both financially with your HRA and also with your advocacy, both from PEB, because that doesn't end either, and then also from VIA benefits. So with that, thank you again for being with us, and we'll talk to you again soon, either one way or another next spring, right? See you then. Thank you.